I want to give you an overview of what a GP does in the UK, because in Poland, for instance, GPs don't really have a big role in healthcare. The reason for that is that private healthcare in Poland is very cheap. So if you have a skin complaint, you will simply pay to go see a dermatologist because it's very cheap. If you want some contraception, you will go see a gynecologist. Whereas in the UK, private healthcare is extremely expensive. So we're talking hundreds and hundreds of pounds to see a skin specialist. And so most people in the UK will come and see a GP because a GP is free. And GPs manage 90% of patient contacts in the UK. And so I'll give you a cool example of, understanding how a GP works in the UK. Obviously, I have a Polish surname and I speak Polish, so I have a lot of Polish patients. And I had this woman come in with her child, and she's like, "Doc, I don't want to waste your time. All I need is a referral to see a skin specialist." And GPs are nice people. In general, GPs are nice people in the UK. So yeah, I don't want to kick up a fuss. Of course, we can do your referral. There's no problem. But you know what? Why don't you just tell me a little bit of what's going on? And she's like, "Oh, my kid, he has eczema. And so that's why I need to see a skin specialist." So I'm like, yeah, we can definitely sort something out for you. Don't worry about that. But what have you tried so far? And she's like, "Well, I basically haven't tried anything because I need to see the skin specialist, right?" So I explained to her, you know what? No problem. What I can do is let me do that referral for you. But actually, eczema is something that we feel really comfortable dealing with in GP. So let me give you some creams. And if they work perfect, you can just cancel the appointment with the skin specialist. But if they don't work, then obviously you'll have that appointment as a backup. Fine. She comes back after a few weeks asking for something else. Maybe it was a referral to see a gynecologist to get some contraception. And I asked her, so how's your kid? How's your kid doing? And she's like, "What do you mean? What are you talking about?" And I'm like, the eczema, the referral, and the creams. And she's like, "Eczema? No, 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 that's gone. The creams worked. I don't need the referral anymore." Essentially, the story is leading to this. GPs have amazing specialized general knowledge. We know the guidelines of a lot of medical conditions. We know where those guidelines stop, and we know when to refer into secondary care. So essentially, contraception, like I can deal with that. Eczema, I can deal with that. I know the guidelines. And so that's what GPs do in the UK. Now, a day in the life of a GP, I work, as I told you, 4 days a week. So I have 8 sessions. A session is about 4 hours. And in a day, I will do 2 sessions, 4 hours in the morning, 4 hours in the afternoon. In my session, I'll typically consult with 14, 15 patients. And then I also have kind of labs. I have some letters from the hospital, some prescriptions that I need to do. And in between those 2 sessions, I have a lunch break. And so that's essentially what my job is like. And then, as I said, 1 day a week, I teach medical students. I teach 3rd and 4th year medical students at the University of Liverpool. And so the cool thing about GP, and excuse me, the cool thing about my contract is that although I'm being paid for 8 sessions, only 6 of those are actually seeing patients. 2 of those sessions are admin sessions. And so in that admin session, so in that paid time where I'm not seeing patients, I can develop interest. So I can develop quality improvement projects for my practice. I can do audits. Again, I can prepare lectures and those kind of things. And so that's the cool thing about GP, is that you have a lot of room to develop your own interests. And that's probably the best thing about GP. So that's generally my life as a GP. I want to tell you guys about the pros and cons of being a GP. So in terms of the pros, you will get a lot of politically correct answers from UK GPs. Why is it good to be a GP? I'm not from the UK, so I feel that I don't have to give you any politically correct answers. And you might get the sense from my videos that I'm pretty direct and I'm pretty much to the point. I will still give you those British answers. So the British answers are, I like the variety of general practice. So essentially what that means is I like seeing the variety of ages, kids, teenagers, adults, older people, people who are dying, palliative care. Again, you have that variety across the human population. And the second bit of variety that you have is you have variety in terms of specialties. So, in one session, I can see derm, gynae, ENT, general medical. I can see something that's completely non-medical, and a patient might just need life advice. And so you get variety in terms of the specialties that you're seeing. Now, the second politically correct answer of why is it cool to be a GP? What are the pros of being a GP? They will tell you continuity of care. So they will basically say, I like the idea that I see a patient and then I can follow them up in 3 weeks and then in a few months and then next year, and I really get to know that patient. I really get to know that journey. And that works upwards and downwards. So I get to know the parents, I get to know the grandparents, and then the kids or the grandkids. And so you become a real family doctor in a sense, that you treat someone's whole family. So those are the two kind of bog standard Royal College of General Practice answers. Why is it cool to be a GP? Now I'm going to tell you my reasons why I feel it's cool to be a GP. So basically, I like to be the boss of my time, and I like to be the boss of the management of my patients. What I mean by that is GP is amazing because you can plan your work around your life rather than planning your life around your work. So basically, if you think of the 4 hours that I have in the morning and 4 hours that I have in the afternoon, I can decide how long my lunch break is going to be. And so, for instance, when I was training for the Great North Swim, it's a mile-long swim in Lake Windermere up north. It's a beautiful event. So in my lunch break, I would go to the gym. I would work out. I would swim for an hour and then go to the jacuzzi, have some lunch, relax, and then go back to my afternoon surgery. And so I didn't need to go to a morning ward round in hospital and then have kind of a consultants meeting and then have the afternoon ward round. I can pretty much plan my life the way I want to plan it. And then the second thing is that, again, you get the sense that I like guidelines. I like protocols because I feel that gives me amazing confidence. And I don't spend a lot of time thinking, what should I do with this patient? Because I know where that guideline is. I just bring it up and I'll just follow it. And so some people don't like that. I like to have that responsibility over my patients, and I like to follow them up. But some people feel that that feels too risky, that you don't have all the safety nets that you have in hospital. So what I mean by that is that in hospital, if you do a prescription for paracetamol, that prescription will be seen at least 5 times before the patient actually gets the tablet. So it'll be done by you. The senior doctor will see it, the nurse will see it, the pharmacist will double check it, the afternoon consultant will double check it, and then the patient will get that paracetamol tablet. And so hospitals are good in that sense because there are all those levels of safety net. And so again, if you kind of worry about making decisions and you keep on, double checking and that kind of thing, then maybe hospital is better for you. I double check anyways. I always double check guidelines because they keep on changing. I always double check the BNF and that kind of thing, but I'm actually confident making decisions, especially if I know the guidelines. So those are kind of the pros and cons of being a GP. I hope that generally makes sense. Again, feel free to send in those questions and then we can go through them. Right, things I wish I'd known before applying for GP training. This kind of relates to the third mistake I made when coming to the UK. And so what I mean by that is when I applied for GP training, I didn't get a place in Manchester. I got it in Preston and Chorley. So that's about an hour and a half away. And you know what I was thinking? GP training, it's only 3 years. Let me just get it over with. Let me just get to that end point. Let me be a GP and then I can kind of start life in Manchester. And again, when we're young, I still feel relatively young, but when we're younger, we're in a rush. We're busy. And so we're very much end focused. So let me get to the end of medical school, right? Let me get to the end of foundation training, right? Let me get to the end of GP training. Whereas I think I would probably tell my younger self, try to be journey focused, try to enjoy every step of the way. And so what I would probably tell my younger self, although, you know what, I had an amazing training experience because my trainer was excellent in Preston and in Chorley. I did have those long commutes back and forth, about an hour and a half, but you know what, I use that to my benefit because through that frustration of the long commute, I created that audiobook, which I was really proud of and is doing really well. And right, so I would probably tell my younger self, you know what, why don't you just spend a year, just locum, just get a better CV, and then maybe apply next year and maybe you'll get a place in Manchester. So yeah, although I am really happy as a GP and I think it's an amazing career and I'm really happy with the training I had, obviously I needed to somehow fill in that point for you guys in terms of mistakes that you can avoid. we're slowly coming to the end of this. I can't believe I've already been talking for almost half an hour, but I hope I haven't bored you to death here. The fourth thing that I want to tell you about is where can I find support if I'm struggling? And this is in general practice. And so it's no surprise to anyone, COVID has had a massive impact on a lot of people. And I'm not just talking about the patients that we see who have lost their jobs, lost their income, are in a lot of financial distress, but it's happening to healthcare staff as well. And so I see this. I have a lot of patients who are healthcare staff who are being hammered. There's just a lot of pressure on people and they're breaking. A lot of people are breaking and they're quitting their jobs in healthcare because they just can't manage the stress and they just can't manage the pressure. And so that's why we're talking about this. And where can I find support? So if I was struggling, where would I go? So the first place that I would go is I would go to the person that hired me. I would go to my practice manager. I would go to the senior GP and I would tell them, you know what, I'm just struggling. I'm burning out. And to give you a quick definition of what burnout is when you see your patients as your enemy. That's what burnout is, because we are here as doctors, as medical professionals, we give a lot to patients. We give a lot of ourselves and we want to help patients. But when you see another patient come onto your list and you're like, you know what, F this, why the hell did he go onto my list? It's only a cough and cold. That could be a clear sign that you're burning out. So you need to seek help. I would go to my practice manager. I would go to the senior GP that hired me. Now, if I felt that I wasn't getting what I wanted from them, so I might tell them, you know what, I need to drop a session. I'm burning out. I'm getting really stressed. If I wasn't getting that, I might debrief with some colleagues. So I still have friends that work in other practices in Manchester, and we meet up every few weeks. We go for a few beers, we talk shop, we complain about staff and patients. That's just life. And then you're refreshed, right? You're ready, get back into your job. You can properly help patients again. So I would speak to people around me. Now, if that wasn't working, I might actually go see my GP. So everyone in the UK has a GP. It's completely free. And I would speak to my GP. If I didn't want to get my work involved or my other colleagues involved, I might speak to my own GP. Because as GPs, we can provide a lot of help in terms of mental health, in terms of stress. So that's the third person I would go. Finally, there is something called an NHS practitioner health site that you can go on to. And if you are a doctor, you can get free help, free counseling and that kind of thing. So those are the 4 places that I would go. Now, we're coming to the very end of this webinar, and I'm going to leave you with some guidelines. And these are guidelines, NHS guidelines about how to be happy. And they came up with 5 steps, and you might have heard this already before. But the first step is connect. So what that means is build relationships with people because they will be your support network when things are going wrong. And I think a lot of us have felt this with COVID. You need to have people to talk to debrief. So that's connect. Number 2 is be active. And what I mean by that is physically active. Exercise. Again, the UK is very prescriptive. The nice guidelines state that you should be doing 150 minutes of physical exercise every week. And that should be a combination of cardio and weight training. So exercise will give you amazing benefits in terms of your physical health, but also in terms of your mental health. Now, the third one is learn something new, learn a new skill. And so for me, that was YouTube. So I learned how to create YouTube videos and it was extremely fun. It was extremely rewarding. Another new skill that I picked up in my older age is skateboarding. And skateboarding is like so much fun. Obviously I wear helmets, I wear kind of pads everywhere. So I look like a complete retard on the skateboard, but I've been doing it for a year and I can successfully drop in now and I feel really comfortable. And that idea of just learning a new skill, that will motivate you and drive you. Now, the fourth thing is give to others. And we're talking about not focusing so much on money all the time, but actually doing something for someone else for free, just because you want to. So it's like this webinar that I'm doing for you guys. I'm not getting paid for this. I'm doing this because I want to give you guys value. And then hopefully by me giving value to you, you'll be able to give that value to someone else and then to someone else and then to someone else. And it will always come back to me. And so if you give to others without worrying about money, without worrying about time, that will make you feel better as well. And the fifth step is mindfulness. So be present. be in the moment. And what I mean by that is that there are a lot of distractions nowadays. We're doing a lot of kind of Zoom meetings in our life. I know a lot of people are on their phone, just texting, clicking away. You're not really present. You're not really listening. And by multitasking, by being constantly distracted, it will wear you out. So those are the 5 steps to happiness. And I hope this is a nice ending to this webinar.